So I'm Daniel Rosenberg. I'm a family physician here at Providence Medical Group Gateway, and you're looking at our co-located team here. I'm one of the 4 physicians who all sit crammed together in a corner, together with our pod PRR Michelle and 3 of our medical assistants here. And the idea of having us all sit together is that it makes communicating and patient care a lot easier, and it happens in a quicker, more integrated way. We had a lot of meetings to decide what kind of changes we were going to enact, and I hate meetings and hated going to them. And they were kind of a painful raking over the coals of our current processes, and it seemed like we were going over a lot of problems that we had gone over in meetings before without really any particular resolution. But this time around, we actually were able to enact some of the changes that we talked about. So having a PRR sitting in our pod and having a patient care coordinator really has changed our workflows, and I think made it easier to be closer to the care of our patients, where there's less care of patients from centralized distant places and more from people who get to know the patients in our corner of the clinic, which makes caring for them, I think, a lot easier and more effective, and I think the patients like it too. This clinic has always had physicians sitting together. When I first started working here around 8 years ago, I had my own office, which I thought was great because I thought I'd finally arrived and I had my own office where I could, think to myself about things, and then I had to share an office with people, and I really like sharing an office with people better because I often come upon problems that I want to bounce off of someone, and when my colleagues aren't here and I see their patients, I want to be able to tell them about it and say, I saw your patient with this, does that sound right to you? I think we actually have been able to provide better care to people all sitting in one place. In our particular clinic, I'll grant you that it's kind of overcrowded and it can be noisier at times, but it's a lot more fun. We like each other. And I think we get to know each other better, and I think it's a lot better for our patients. We've gotten in the habit of covering for each other's patients, and some days together with our physician assistant there can be 3 or 4 people and a med student together in this room, but there's usually just 2. And because we all sit together and it's the same group of us, we get to know our colleagues' more difficult patients instead of just having them be random people in the clinic. So that gives us more of a foothold of providing a bridge of care for them until their usual provider is back in the office. So whenever possible, we try to make patient phone calls just one leap, or we call it one touch. Not really touching someone over the phone, but when there's a question, instead of telling the patient that we'll call them back and then trying them with their work number and their home number, and that one's not that quite right, by being co-located with our administrative colleagues, we can, most of the time, they can find someone right away, get the patient's question answered, and avoid a lot of extra work of back and forth phone messages. So this is going to be a lot of like all the other challenges you've faced in your life. Nothing ever stays the same, and things change over time. And I confess that for the most part, when there's change, there's always part of me thinks that I'm getting screwed, that this is because of tightening resources, or someone wants more paperwork, or someone at some other hospital 2 states away put the wrong thing in an IV bag, and so the rest of us have to suffer an eternity doing triple checks on things. But the difference with the medical home thing is that by and large, it really has been designed to make care of our patients more effective by making providers' lives a little bit easier. So even though the transition, I think, can be rough, it's nice to know that they actually had me in mind for once.